Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It is a complex and heterogeneous condition with various symptoms and levels of impairment. Here's a breakdown of schizophrenia. 1. Definition: schizophrenia is a psychiatric disorder characterized by a combination of symptoms that can include hallucinations, perceiving things that are not there, delusions, false beliefs, disorganized thinking and speech, disorganized or abnormal motor behavior, and negative symptoms, reduced emotional expression or motivation. 2. Positive symptoms: hallucinations, experiencing sensations that are not based in reality, such as hearing voices or seeing things that others don't. Delusions: holding fixed, false beliefs that are not influenced by evidence or logical reasoning, such as beliefs of persecution or grandiosity. Disorganized thinking and speech: difficulty organizing thoughts and expressing them coherently, leading to disjointed or incoherent speech patterns. 3. Negative symptoms: reduced emotional expression, a decrease or absence of emotional responsiveness, such as a flat or blunted affect. Avolition: lack of motivation, decreased ability to initiate and sustain goal-directed activities. Anhedonia: diminished ability to experience pleasure or derive enjoyment from previously enjoyed activities. Social withdrawal: decreased interest in social interactions and a tendency to isolate oneself. 4. Cognitive symptoms: impaired memory and attention, difficulties with attention span, working memory, and retaining new information. Executive dysfunction: challenges in planning, problem solving, and organizing thoughts and actions. Impaired decision-making: difficulty in making sound judgments and evaluating consequences. 5. Onset and course. Onset: schizophrenia typically emerges in late adolescence or early adulthood, although it can occur later in life. There can be a prodromal phase characterized by subtle signs of deterioration before the onset of full-blown symptoms. Course: schizophrenia can have a chronic course with varying levels of symptom severity and functional impairment. Some individuals experience relapses and remissions, while others may have persistent symptoms. 6. Causes and risk factors. Genetic factors: there is a genetic component to schizophrenia, with a higher risk if a close family member has the disorder. Neurochemical imbalances: alterations in brain neurotransmitters, particularly dopamine, may play a role. Brain structure and function: abnormalities in brain structure and connectivity have been observed in individuals with schizophrenia. Environmental factors: prenatal and perinatal complications. Exposure to certain viruses and psychosocial stressors may contribute to the development of schizophrenia. 7. Treatment: medication. Antipsychotic medications are commonly prescribed to manage